Magnesium is integral for 600 plus biochemical processes in the human body, and yet most people are deficient. Common signs of magnesium deficiency include fatigue, muscle weakness, stunted growth, poor immune function, poor concentration and memory, hormonal imbalances, bone and teeth problems. Most people think grabbing a bottle of whatever cheap stuff on the shelf or at the top of Amazon will solve this. The common misconception is that consuming more magnesium will automatically improve health and well-being. The truth is there are various forms of magnesium, each of which is essential for a variety of physiological processes. Most people are deficient in all forms of magnesium, while even those considered healthy typically only ingest one or two kinds. Consuming all 7 of magnesium's primary forms is the key to accessing all of its health benefits. That's why we pack 7 forms of 450 milligrams of elemental magnesium into each serving of Wild Mag Complex. 1 dose a day is all you need. Learn more and grab a bottle today at wildfoods.co. Use code GENIUS for 10% off your order. Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers, because once we do, we'll be able to put a donate button, and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD, and working on a product to help people overcome these problems, because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you can buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions,
common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast, now part of the Finding Genius Foundation. My guest today is Michelle Min, MD. She's a part of rheumatologic dermatology. She's also in the Department of Dermatology at University of California, Irvine School of Medicine. So we're going to talk about various skin issues, rashes, etc., and find out about her research and her work. So, Michelle, thank you for coming.
Thanks for having me, Rich.
Yeah, if you would tell me about, how did you get into dealing with skin? Were you like an aficionado of Dr. Pimple Popper online, or what got you into it?
Hardly. I actually didn't even know I wanted to do medicine until later in college. I thought I always wanted to be a researcher, so I always liked science, but I didn't know I wanted to become a physician specifically until I was doing a lot more bench research in college, and I realized it really takes a special, unique person to deal with all the failures in the lab. It's a very slow process before you succeed. And I just have to say, I admit I didn't have the patience. So I realized I really missed interactions with people, and I liked to have it. I wanted to work in a field where I could help people, but maybe a little bit more of an immediate gratification. So that's why I chose medicine. And then, why skin? My father's actually a pastor, and we went to this medical missionary trip in Haiti. And you can do a lot with skin. The organ is right there. You see it. You don't really need to rely on a test to diagnose a patient and to help a patient. I thought that was really, really cool. So when I decided I wanted to do medicine and I had this experience of this medical missionary trip, I decided to focus on skin. And then, life happened. I really met the right mentors, which I think is so critical to success. I got lucky. I met the right mentors, and they got me interested in research and interested in rashes specifically, and complex medical dermatology, and really the challenging cases. So that's how I got involved with clinical research and rheumatologic dermatology.
It'd be funny if you told people you're in this field because it was a rash decision, literally. So are you doing research, or is it more clinical work, or what does your day look like?
Yeah, I'm primarily a clinician. I do some research. It's, primarily when I'm seeing patients, I think of a question. I'm like, I wonder if anyone's looked into this. And then I'll see what's out there in the literature. And if it's not been answered, I'll answer it based on my patients. I have some experience in, the big clinical trials working with pharmaceutical companies. I'm doing a little bit of that as well, but I'm primarily a clinician because I really enjoy seeing and treating patients.
Okay. So what are some of the, I don't know, the most common or tricky types of skin conditions you're seeing now in clinic?
So I think one of the trickiest conditions is actually dermatomyositis. It's a rare disorder, so not many people see it. Not many dermatologists or rheumatologists see a lot of it. And it can mimic a lot of other conditions. And it comes with many different internal symptoms as well. So it can be really confusing. And unfortunately, there's no slam dunk biopsy finding or a slam dunk blood test to give you the diagnosis. So you really just have to be experienced at seeing a ton of it. So I see patients referred for quote unquote eczema or psoriasis or lupus, and I take a look at them and I'm like, that's not what you have. You have dermatomyositis. And it's really an important, condition to treat because it's associated with cancer in about a third of patients.
What is it?
Yeah. So dermatomyositis is an autoimmune skin condition. It can be associated with cancer, but not always. It can be associated with a quite devastating lung disease as well. And it has really specific clinical findings. So you just need to be experienced seeing it over and over. Because otherwise, the facial features can look a lot like lupus. The hands can look a lot like eczema. The elbows and knees can look a lot like psoriasis. So I think it's often misdiagnosed and probably underdiagnosed, but it's so critical to catch early because of that association with cancer and lung disease. Yeah, I think it's one of the most challenging diseases that we see in rheum derm.
Okay. Did you ever deal with, I don't know, like drug-induced rashes when people take certain medications, or, what's the landscape of that look like?
Sure, all the time. I mean, a lot of our autoimmune skin conditions, they have known drug associations too, drug triggers. So that definitely comes up.
All right. So what's an example of some conditions that happen, and do they, most rashes go away even if they're drug induced, or are there some that last forever, literally? Like, what does it look like?
Yeah, that's a great question. It really depends. If you're lucky, you take away the drug trigger. And I think the most rashes that are caused by drugs, you take away the drug trigger. It might not be immediate, but after a couple of weeks, the rash will resolve. Sometimes it's more just like the drug triggered this underlying predisposition to getting a chronic rash, right? So you probably had some genetic position to getting it. You have something that triggers it, and in this case, a drug. And it unfortunately won't go away because you might have just, eventually we're going to get it, but, you needed that kind of trigger. So it's not clear cut. But an example, for rheumatologic dermatology is there's a type of lupus of the skin, actually, that's associated with really common blood pressure medications, for example, or actually heartburn medications that you can just buy over the counter. So, we do see an association there. And a lot of these newer medications, I mean, medicine's really exciting right now, right? There's all these new drugs hitting the market. And that's fantastic, but we don't fully understand some of the rarer side effects. And a lot of them have these rare rashes that could be associated with them. And then the other challenge is, with clinical trials, if you look carefully, you'll see, for example, 6% of these patients had a rash. But they won't really go into detail about what kind of rash, mainly because it's not dermatologists that were running the clinical trials. So that rash could mean something like an acne-like rash, or it could be a full-blown, skin falling off type of rash. So it's challenging because a lot of these newer drugs are coming out, and we don't fully understand the drug rashes are associated.
So again, are there skin conditions or rashes that there's nothing you can do, or is there always something you can do to help somebody?
I think there's always something you can do. I mean, it might not be the first thing that you try, right? So, but the challenging conditions are challenging for a reason, especially the rarer ones. Sometimes it's just a matter of trial and error and finding the combination, the cocktail, that works.
What about skin microbiome? Are you hearing, practitioners looking at that very much, or are they just like, whatever?
It's a hot topic. No, it's a hot topic. It's not my area of expertise, but it's a really hot topic in research. There's always articles about, coming out about skin microbiome. I think eczema and psoriasis are probably the best examples of, emerging research with skin microbiome. But I have to say it's not my area of expertise, but it's definitely a hot topic.
Magnesium is integral for 600 plus biochemical processes in the human body, and yet most people are deficient. Common signs of magnesium deficiency include fatigue, muscle weakness, stunted growth, poor immune function, poor concentration and memory, hormonal imbalances, bone and teeth problems. Most people think grabbing a bottle of whatever cheap stuff on the shelf or at the top of Amazon will solve this. The common misconception is that consuming more magnesium will automatically improve health and well-being. The truth is, there are various forms of magnesium, each of which is essential for a variety of physiological processes. Most people are deficient in all forms of magnesium, while even those considered healthy typically only ingest one or two kinds. Consuming all 7 of magnesium's primary forms is the key to accessing all of its health benefits. That's why we pack 7 forms of 450 milligrams of elemental magnesium into each serving of Wild Mag Complex. 1 dose a day is all you need. Learn more and grab a bottle today at wildfoods.co. Use code GENIUS for 10% off your order.
Are there new protocols? Like I saw one dermatologist had a special light. I don't know if it was UV. So when they look at the skin, normally with the eye, it looks one way. With this special light, it looked very different, and they were able to see conditions that they couldn't see before. So, like, are there any special tools like that you're using clinically that are newer, that really are getting you good results?
Yeah. I actually think you might be referring to the Woods lamp, which is a super old school technique that we've been using where, what looks like subtle changes in discoloration can really light up. There are certain bacterial organisms that actually really light up with that lamp. But there are in terms of medications, that's constantly shifting. It's like every month there's a new medication in dermatology right now. Dermatology is a really exciting field to be in right now because of all the different drugs coming out. But in terms of devices, sure, there's always advancements in lasers, for example. I think one of the big devices that could really change how we treat patients is the device called OCT. It's, in a simplified way, it's almost like an ultrasound of the skin. So you may be able to diagnose without having to cut into the skin or, do a more classic biopsy to see, for example, if you think there's a high likelihood of a skin cancer. So if there's, let's say there's a bump on the face, it doesn't look super classic for a skin cancer. Patient doesn't, really want to biopsy the face if you're not, you don't have a high concern. And maybe this OCT device, for example, that'd be a good example of a time that you could use this device to see if you have higher concerns when you look that way. It's a non-invasive technique. I think that's probably one of the bigger advances that's coming into dermatology that's still fairly new.
Okay. Are you noticing any change in people in general? It seems like a lot of people have a lot more anxiety and stress. Is that manifesting in people's skin in different ways?
You mean post-COVID, or you just mean like in life?
Both. But yeah, like recently in the past, year or two, are you seeing any change in people, or is it, a much slower thing over time that you're noticing changes, or maybe you're not noticing anything? I don't know.
I think a lot of the conditions that were around pre-COVID are here post-COVID. There is always this concern. It's a common concern. If there's a new diagnosis, could it have been triggered by COVID vaccine or COVID infection? I think that's a really hard answer or hard question to answer because it's so prevalent, right? And then, question of timing, there are certain skin conditions that occur within a day of an exposure. And there are other skin conditions that it's classic for them to occur weeks, maybe even months after an exposure. So people often ask me that. I think that anxiety, whether it could be COVID vaccine or infection related, is still really prevalent, and we just don't know.
Oh, but you're not seeing any new things that you haven't seen before that
we have something called COVID toes. I don't know if you've heard of that. It was found to be associated with COVID. It looks like hernio, which is actually a rheum derm condition. It's a condition of these really painful bumps on the fingers or toes, usually triggered by the cold and classically seen in patients with autoimmune skin conditions. We saw a lot of it during the peak of COVID, for example, especially when the virus was doing stranger things. So there are specific rashes associated with COVID as well.
Okay, but in general, you're not really seeing too much new. It's just kind of a continuation of what you've seen for years.
I think so.
Okay.
If you ask someone else, maybe they would disagree with me, but I don't think so. I think a lot of the stuff that we are seeing now is stuff we saw before.
Okay, yeah, that's what I wanted to know. Are you doing only clinical work? Or are you doing any research? And if so, what does the research look like?
Yeah, I'm definitely doing some research as well. One of the papers we're actually working on is looking at hyaluronidase. It's actually used in a cosmetic setting, but we're using it to treat patients with scleroderma that have trouble opening their mouth. So scleroderma is another autoimmune condition we see in rheum derm clinics, where the skin begins to progressively tighten. Really a terrible disease. People can't, the example is, open a jar comfortably because their hands are affected. Now, scleroderma will, or systemic sclerosis, I should say, will also commonly involve the face, and there are patients that have trouble opening their mouths. So the reason we decided to study hyaluronidase for people that have trouble opening their mouths is we actually had a patient whose disease was pretty well controlled. She had classic systemic sclerosis, and she had pretty well controlled disease, but she was a singer. And she felt like the quality of her singing was affected. She liked performing on stage, and it was hard for her to perform the way that she wanted to. And so the rheumatologist actually referred her to our rheumatologic dermatology clinic for treatment. And we thought, mechanistically, the way hyaluronidase works is it breaks kind of like fibrotic tissue. And in dermatology, it breaks down filler that we use to inject in people's faces, for example. So we thought, it might help this woman. And so we injected around her mouth. And I mean, we were shocked. Just after a single treatment, she was able to open her mouth wider. And we kept injecting monthly. And so we decided to try it for a couple of patients. Listen, it's not a super prevalent problem. So we only had a handful of patients, but I believe we're the first group to do it on more than one patient. So we're working on publishing our findings there. But yeah, I mean, I think it's a really cool, safe option. It's not like an immunosuppressant medication, which a lot of these patients are on immunosuppressants already. And this patient, I mean, she was thrilled. Like we almost had a hard time getting her to stop getting treated because she was saying she hadn't puckered her lips to kiss her husband in years. When she went to the dentist, he would have a hard time cleaning her teeth. So like a basic cleaning, she said, would take over an hour. And now it was down to less than half an hour. She bit into an apple, a big hamburger for the first time. She used to always have to cut it up in small pieces because she couldn't really open her mouth all the way. So, so that's one example of a research project that's pretty much wrapped up and we're writing up. But, the rheumatologic dermatology, not that many people, studied it many years ago because these are rare disorders. So there's a lot of opportunity for research there.
Yeah, no, that's excellent. So if someone has a skin problem, obviously they may call a dermatologist, but any helpful hints for people on how to navigate the derm world? Because they're not experts. They don't know. I mean, depending on which condition, what kind or flavor of a dermatologist should someone look for?
That is a great question. I think it's a misconception that all dermatologists do the same thing. And, just like I'm an expert in autoimmune skin conditions, like if I had a patient coming in to, looking for a Dr. Pimple Popper, they have this massive cyst and they want it removed, I'm totally the wrong dermatologist to see. I have a colleague I can refer you to. I think, we're dermatologists, we're a small group and we know who the other dermatologists in our community are. We know who the experts in our field are, even beyond our local community. And so I think if you start with your local dermatologist, that's a good first step. And if they know that, this is outside of my comfort zone, they'll refer you to the specialist because, again, we're a relatively small specialty. So they'll refer you to the right folks.
Okay, but is there any words or special designations that people not, like what kind of dermatologists are there? Like you said, you're a rheumatologist. I didn't even know that existed. What are some other flavors of dermatologists that people don't even know exist that may help guide them?
To be fair, I think we're a rare breed. But I think overall, like there's big groupings, right? There's pediatric dermatologists. Then you have your cosmetic dermatologists, right? They're more of your laser specialists, for example, your chemical peels, Botox fillers. I think they're the dermatologists most people think of when they're thinking of a dermatologist. Then you have your medical dermatologists, and then from there you have, within medical dermatologists, you have areas of specialization, right? So your general medical dermatologist, they're going to be very comfortable with looking at, routine eczema, acne, skin cancer, and most rashes. And then when you start kind of going into the rare things, then you may want to look for a subspecialist, just depending on the condition that you have. There are specialists in blistering diseases, for example. There are specialists in eczema, allergic dermatitis. That's a common subspecialty. There's something called oncodermatology, right? Like, lymphoma of the skin. You really want someone that has a lot of specialized training and expertise in that, for example. And then, of course, you have your surgical dermatologists. They're also a different group as well. They're more comfortable doing these large, cancer removals and, or huge cysts like you might see on Dr. Pimple Popper, for example. So we do have these little niches. And certainly, you can read a bio online of a provider, but if you're unsure, I think you start with your general dermatologist, your local dermatologist, and they'll refer you to the right places. And I'll say in general, if you're going to a large academic institution like UC Irvine, they're more likely to have all these subspecialists too.
Yeah, makes sense. What if you have a skin problem and you call around and the first dermatologist available is not for like 6 months or 3 months?
That's a common problem. That's a really common problem. I mean, I think if you end up I think everyone should have a primary care, right? So if you start with your primary care physician and you have a good relationship with them and they agree you have something that really needs to be seen urgently, ask them to reach out. That goes a long way. So I have a lot of local rheumatologists. They have my cell phone number and they'll just call me up and they'll tell me, hey, I have, they'll tell me what's going on. This is, what we've tried. I could really use your help here. I don't think the patient can wait for your next available. Any way you could see them sooner, and we'll always get them in.
Oh, that's good. That's excellent.
Yeah.
Yeah, I know that's probably a common frustration. That's why I wanted to ask you.
Oh, yeah. No, it comes up, I think, every single day where people are, they come in and they're like, I waited 3 months for this appointment. I'm like, oh, I'm sorry. And I'm one of the newer faculty. I can't imagine the ones that have been around for 20, 30 years. They must have a large patient base, and their wait time's got to be even crazier.
Are there, I thought about this. I don't know if it exists, but what if there was an app that had various filters and you can use your smartphone to take pictures of your skin and then, transmit that to a dermatologist and have them at least give like an initial, well, I would consider this, that, or the other, obviously still make an appointment, but I would consider this, that, or the other, or, it doesn't look like what you're dealing with is very difficult. Here's what I'd suggest. Like, is anyone doing that?
There are some mechanisms of that. So, at least at UC Irvine, we have something called an e-consult. Now, it does have to come through the primary care physician, right? The primary care physician will take photos and may, initiate an e-consult, which I think the wait time for hearing back for that is more just a matter of days. So there is a mechanism in place for that, at least at UC Irvine. And then, of course, there's telederm, right? That's something that COVID introduced, or telemedicine, we call it telederm. I will say it's an imperfect vehicle, photographs or even video, just because the quality of photos can really vary. Lighting is really critical, and, taking a look, if a patient comes in with a full body rash, I need to be able to look up close. I need to take a step back and, see which areas are involved. So sometimes it's difficult to do based on photographs. There are certain things super easy to do with a photograph, and other things, especially a first-time visit, it's just hard.
So even photographs and video, even with today's cameras that have high megapixels, it's still not clear in certain cases?
Well, I think the challenge is, especially in a large institution, they're going to want to use encrypted or high privacy vehicles. And so for UC Irvine, at least, there is a way to do it through Zoom. The problem with Zoom is that people, it's a good problem for like regular meetings. There's all these like natural filters in, right, that smooth out your complexion, for example, or they'll like blur out a background. So if, to guide someone to kind of undo all those filters, and I think there are some just natural filters in there. But it's funny, I actually just had a patient for an acne telemed visit this past week. And she was like, do you see the breakout I have on my face? And I was, kind of squinting and leaning into my camera. And I think it was the filter. I was like, your skin looks clear. So, there are some challenges there.
Well, I mean, I guess, yeah, someone would have to work on maybe a custom camera filter.
Yeah,
I know there's a device that lets you see like in, infrared on iPhones. You could plug it onto the device. And I wonder if there would be such a device that, like, again, if you look in visible light or if you look in other lights, have you seen that you can see things you can't normally see if you look in, let's say, infrared, or if you look in UV?
Right. That Woods lamp we talked about is an example of a special, like, there's a special light that helps light things up. There, it was interesting during COVID. So there were people that were worried about, skin cancers, for example. That's something that you really need to come in person, because we have a special light that actually, it's almost like a glorified magnifying glass in a way, but that can look really close at a lesion. That's something that you couldn't do with just a regular camera, right? And there was some thought of, having patients buy a similar type of tool and then teach them how to take photographs using that glorified magnifying glass. We call it a dermatoscope. Almost every dermatologist has one in their pocket. It helps us look closer at skin lesions to see if, there are some concerning features, for example. So there was some thought, you could get a patient to buy a cheaper version and upload photos. But I think there would be a lot of, there would be a lot of guidance required on using the devices. But it's a valid point. It's certainly, I think, something that could be improved upon.
Yeah, what if, you gave these special scopes to primary care physicians that, obviously they're going to refer, but if you get some primary cares that see a lot of this stuff, maybe they would be a good, again, referral source if they had the right equipment. Not to diagnose.
Yeah, I think the use of technology that way definitely makes sense. So when we were in New York City, we actually worked with a hospital in a very remote part of New York State, in upstate New York. They didn't have many dermatologists in this area. And so we actually worked with trained nurses there who were comfortable using this dermatoscope and taking photos through the dermatoscope so they could take more targeted photos. And then we would do video visits with the patients and, to hear a little bit more about the background about the skin lesion or the rash, for example. And we might even then go back to the nurse again and say, hey, can you actually take another close-up photo of the lesion on the left arm or whatever. So actually what you're mentioning, it was, and we did that pre-COVID actually. So I think it's a good idea. We could totally work with primary care physicians on that, or in this scenario, areas that are more rural, for example, they just don't have many dermatologists and there's an access issue there.
Okay. And what do you see as the future of dermatology? What do you think it's going to look like?
Future dermatology is really exciting. So first of all, I have to say, because I'm a rheum derm person, there's a lot more growing interest in rheum derm. I do think there's going to be more and more interdisciplinary clinics. Providers of different specialties are communicating more, especially with the use of electronic medical records. And I also think that there's a lot more interest from pharmaceutical companies in studying rare and challenging diseases and coming up with these really safe, targeted medications. This is already happening in dermatology and it's just exploding. So I think in the next few years, we're just going to have way more treatments that are specific to different diseases and therefore safe.
Okay, that's excellent. Well, for listeners, you probably don't need more business, but where do you serve? And then, like for someone to look for a dermatologist, are there good directories online, or should they just use Google? Like, again, how can people find you and more about your work and your research? And then how can they find dermatology help in general?
Right. So the National Academy, the AAD, that's the National Organization for Board Certified Dermatologists. So you can certainly start there to find a dermatologist near you, and they have a big directory of all the board certified dermatologists. And I think it is important for people to know that, there is a distinction between a board certified dermatologist and another provider that practices dermatology. And then in terms of where I practice in UC Irvine. That's in Orange County, just south of LA County. But yeah, I mean, you could go to the UC Irvine website and find us there.
Okay. All right. Very good. Well, Michelle, thank you so much for coming on the podcast and, being open and honest about, what happens in the dermatology world. So thank you.
Yeah, it's my pleasure. Thanks for having me.
Magnesium is integral for 600 plus biochemical processes in the human body, and yet most people are deficient. Common signs of magnesium deficiency include fatigue, muscle weakness, stunted growth, poor immune function, poor concentration and memory, hormonal imbalances, bone and teeth problems. Most people think grabbing a bottle of whatever cheap stuff on the shelf or at the top of Amazon will solve this. The common misconception is that consuming more magnesium will automatically improve health and well-being. The truth is there are various forms of magnesium, each of which is essential for a variety of physiological processes. Most people are deficient in all forms of magnesium, while even those considered healthy typically only ingest 1 or 2 kinds. Consuming all 7 of magnesium's primary forms is the key to accessing all of its health benefits. That's why we pack 7 forms of 450 milligrams of elemental magnesium into each serving of Wild Mag Complex. 1 dose a day is all you need. Learn more and grab a bottle today at wildfoods.co. Use code GENIUS for 10% off your order.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.